Hi everyone, welcome to ResearchMD.com. Another great presentation today. We're going to teach you in an overall how to look at anemia. Okay, that's the main purpose of talk. Again, my name is Pramil Cheriyath. I'm a program director in internal medicine residency. I'm also program director for transitional residency, assistant professor of medicine, two large medical schools. So we're going to look how to do investigations on anemia in a nutshell. Okay, that's the whole purpose. Okay, so please join us. Let's start it. So when you look at anemia, the first thing we are going to look at? We're going to look at the hemoglobin level, right? You look at the hemoglobin and see if the patient is anemic or not, right? In the men, the hemoglobin is a little bit higher, and the female is less because of the because of what? Why is it men have like a higher? Because of the testosterone levels and all that. Remember that, okay? So when we have, next thing you have to do is you do MCV. You look at the MCV, okay? And based on that, you can kind of put it into some categories and see then your diagnosis, and you can have this algorithm to work towards the cause to find out what's actually going on. So first thing is, you look at the MCV, we need to know what is normal MCV. Somebody tell me what is a normal MCV, please.
80 to 100.
80 to 100, okay. This belongs to this category right here. What is microcytic? Somebody tell me louder what is microcytic.
It's less than 80.
Less than 80. So this numbers, it's good to know the numbers, okay. So less than 80. And what is it over here, macrocytic?
More than
100.
More than, macrocytic is more than 100, okay? So you have to put those into categories. So I'm going to go back again. You check the hemoglobin, make sure you know male is higher, female is a little bit low, and the next thing you do is you look at the MCV, and based on the MCV, we put them into three broad categories, okay? Now, let's start with over here, the first thing. Which type of, we got microcytic anemia, so it's less than 80, okay? So the question is, what is the first thing we should come to our mind when you have microcytic anemia? What is the first one? We talk about iron deficiency anemia. Okay. What's the most common cause of anemia in the world?
Iron deficiency.
Iron deficiency. You know, if you look at it, that's like 50% of the whole anemia is like iron deficiency anemia. So most of the time, you get 1 out of 2 chances. Somebody with anemia, if you say this is iron deficiency anemia, most of them you're correct. Everybody agree with that? So in that case, you check so you have to, first thing you do is check serum ferritin. Okay, so you order serum ferritin, and if it is low, you can say iron deficiency anemia. Okay, now there's some cutoff we wanted to use for serum ferritin. The first thing you look at, the serum ferritin is less than 30. Your sensitivity and specificity is extremely high for iron deficiency. Everybody got that? Okay. Now, if you look at, so sensitivity, so if the ferritin level is less than 30, right, your sensitivity is like around 92% and specificity is around 98%. Everybody got that? It's good to know this. If you can express in numbers, pretty much the diagnosis very clearly. And if the ferritin is like, if you bring it down less than 15, the sensitivity and specificity still go high, very high. Okay.
Dr. Cheriyath, can we check for soluble transferrin receptor?
Yes,
test?
Very good. This is like, why aren't we doing it? It's another good test, like, recent test coming in, soluble transferrin receptor assay. What do we usually used to differentiate between anemia chronic disease and iron deficiency anemia. It's a good test to do that. Why aren't we doing it? Somebody said, what is the reason? Anybody know? It's very costly. It's going to cost a lot of money. So that's why people kind of hesitant to order the test. It's called the soluble transferrin receptor assay. Okay, remember that. The sensitivity is around like 86% and specificity around 75%. Okay, but that's one of the brand new tests. Hopefully we'll come back and, so you can, there's some tests you can kind of remember that. Those two things you have to know, right? Now, so what happens in the RDW in iron deficiency? Increased. Okay, so remember that. You can look at the RDW, you look at the ferritin, if it is low, increase RDW, pretty much you can say iron deficiency. Plus, I know 50% of the anemia is due to iron deficiency anemia. Okay, so now let's look at the ferritin. Let's say ferritin come back to normal, okay? So what is the other characteristic of ferritin? Somebody tell me. It's an inflammatory marker, okay? So anytime there's an infection or inflammation, or there's like ferritin can go up. Okay, so that is going to make the diagnosis very difficult. That's why we know when we talk about the soluble transferrin receptor assay and all that is going to come to play. So if the ferritin is normal, and then you can put them into two categories: acquired microcytosis, or you got chronic microcytosis. Okay, two broad categories we put it in. So if it is chronic microcytosis, what do we have to worry? Somebody tell me.
Thalassemia.
Thalassemia. What the test you have to do? Hemoglobin electrophoresis, right? Because it's going to use electrical activity to differentiate. So you do that. Let's say it's an acquired, right? Acquired, what are the causes? Consider anemia of chronic disease. Okay, so anemia of chronic disease, sometimes it could be MCV normal also. Later on, it becomes low MCV. I just want you to remember that. Okay, anemia of chronic usual causes, like anytime there is an anemia of chronic disease, what does that mean? Chronic disease. Anytime you have chronic disease, you can have anemia of chronic disease, okay? But some categories we have put it for you to know and all that. It's very common when you have like end-stage renal disease is very common, you will see that, remember. But I just don't think it's not always going to be low MCV. But the later on, initially the MCV could be normal in anemia of chronic disease. The other formula I want you to know is Menser index. Okay, in children, it's a good test to differentiate between, for iron deficiency anemia. Okay, so what is the formula? You take the MCV and you divide that by RBC count in million, and then you get a Menser index. If it is greater than 13, you can say it's iron deficiency anemia. Okay, very good test. It's less than 13, you say it's beta thalassemia. Everybody got that? So the point from here is like it's very important, the role of ferritin. Remember, ferritin is also what? It's an inflammatory marker. And based on the ferritin, you put them into two categories. Okay, if it is less than 30, less than 15, sensitivity and specificity is extremely high for this test, and RDW is going to be increased. Remember that. Okay, and then remember the Menser index also in children to use it. And then what else we talk about? We talk about the soluble transferrin receptor assay to differentiate between anemia, iron deficiency anemia, and anemia of chronic disease. Okay, so one more, when we talk about ferritin, that's another examination question. See, everybody knows this. When you have ferritin like 30,000, you got a rash on the leg. What is that patient may be having? A high fever. What's our diagnosis?
Infection.
I don't know. That's like it's telling us a broad differential infection. What is it? What's going on? What is the disease called? Anybody know? Adult onset still disease.
Okay.
They usually have salmon-colored rash on the leg. Okay, remember that. So serum ferritin is like, usually the question is going to be serum ferritin is like 30,000. You got like salmon-colored rash, anemia. You had adult onset Still's disease. Your diagnosis. Okay, but that's out of our scope. We'll come back and teach you about adult onset Still disease. But we need to know that now. What's our next step? We're going to move over here. It's a normocytic anemia. Okay. That's one in the middle. You got normocytic anemia. Now, when you talk about normocytic anemia, what's the MCV usually?
80 to 100.
80 to 100, okay? So you can put them into three different categories. What is this? You can say nutritional, you can say hemolytic, and anemia of renal insufficiency. You can say that, okay? So everybody got that? You got nutritional, if it is, and hemolytic, and anemia of renal insufficiency. Most important, I would start in the middle, hemolytic, okay? Hemolytic anemia. So you need to look for some other indicators of hemolysis. The best thing to do is like what? You can check all 4 parameters you can look at. First is haptoglobin. Okay, what happens is like when there's hemolysis, what happens? RBC break down. Okay, and the hemoglobin is binding with the haptoglobin, so you will have decrease haptoglobin. A lot of people sometimes forget, it's like, they always say, does it goes up or does it go low? That's like usually the confusion among the people. But, so somebody tell me what's going to happen to haptoglobin? Decreases, okay? The other markers, and all of them will go up. Only thing is going to be decreased is haptoglobin. Remember that, okay? So, LDH goes up. Everybody got that?
Yes.
And then what? Indirect bilirubin
Increase.
goes up. What about reticulocyte count? Increase.
Increases.
Okay? So remember the difference between, people always get confused about the haptoglobin. You need to know why haptoglobin is decreased also. It's good to understand. Then you look at the nutritional, you got serum ferritin, you can check the homocysteine level, and then you can look at anemia of chronic insufficiency, chronic anemia of renal insufficiency, check serum creatinine level, you can see like chronic renal failure is very common, okay? So when you look about the hemolysis, we already said decrease haptoglobin, increase LDH, right? Increase indirect bilirubin, increase reticulocyte count. What is the next step? There's a couple of more steps you can do up here. One, you suggest hemolysis, you look at the spherocytes, okay? If it is spherocytes, it can be like autoimmune hemolytic anemia, hereditary spherocytosis, and all. They can do the Coombs test and osmotic fragility test, okay? We're going to come back to this in detail. We're going to give a lot, we're going to teach you everything about anemia. But today is in a nutshell, in a broad picture, what we need to do. So, and then if it is schistocyte, it's TTP, hemolytic uremic syndrome, DIC, vascular hemolysis. It's good to see the pictures of this, like how does spherocyte look like, okay? How does schistocyte look, because sometimes the examination, they're going to put like some, put pictures and you have to identify and come with a diagnosis. So two of these things you have to see how schistocytes look like and spherocytes look like, okay? Very important now. So everybody got it. So the most important, the hemolytic. So I'm going to review it again. When we talk about the hemolysis, the first thing we have to know, look at the markers. Haptoglobin decreases, and LDH and indirect bilirubin, reticulocyte goes up. And the next step is like, suggest you look at the peripheral smear, right? If there is spherocytes, autoimmune hemolytic anemia, hereditary spherocytosis, everybody got that. And if it is schistocytes, you have to know GTP, hemolytic uremic syndrome, in that category, okay? You can say like if it's a vascular hemolysis also. Everybody got that? Now we're going to move up here. What is this called? A macrocytic anemia. Somebody tell me what is the number of macrocytic anemia?
More than 100?
If it is more than 100, we'll say macrocytic anemia. So first thing, you have to make sure you rule out the two drugs. What is a common two drug? Hydroxyurea and sitagliptin. Everybody got that? Hydroxyurea and sitagliptin. Those two drugs can cause like, the MCV go really high. Next thing is like, you can differentiate between megaloplastic and non-megaloplastic, okay? Megaloplastic is on this side. What is the megaloplastic? Somebody hypersegmented neutrophils, okay? It's good to know that. So the next step we do, you order a test to check for vitamin B12 and folate. You order both the vitamin B12 and the folate levels. Everybody got that? Okay, if the folate is decreased, what does that mean? It's like folate deficiency. But that's okay, everybody know. Now it's more complication when the vitamin B12 decreases. Okay, so we have to do some steps to make sure we know what's going on. When the vitamin B12, you check the vitamin B12 and you have to put them into different categories. If it is less than 100, you don't need any further tests. Everybody agree that? That's pretty much a diagnostic. Everything bucks stop there. You treat vitamin B12. Got it? Let's say if it come back between 100 and 400, or like, upper limit, lower limit. It may be still in the high range, but it's the lower limit of the high range, okay? If it is 100 to 100, you have to order two tests. Which one? Methylmalonic acid and homocysteine. So if it is vitamin B12 deficiency, both of them is going to be elevated, okay? If it's only homocysteine is elevated, it's the folate deficiency, okay? Everybody got that? That's the megaloplastic. The non-megaloplastic, we have to think about if it is MCV is like extremely high. Let's say it's like 110. They're huge, right? What are the things you have to, myelodysplastic syndrome, bone marrow disorders, you have to think about it. Okay, if the MCV is like between 100 and 110, it's still myelodysplastic syndrome. We can kind of talk about it. Liver disease, alcohol consumption, hypothyroidism is very common, right? When I mean, see some MCVs like extremely, I always wrote alcohol or maybe like one of the common causes. A lot of alcohol disorder, patients with alcoholic disorders are there, and you got the and also hypothyroidism causes it. Okay, did everybody understood? Okay, it's in a nutshell. So we're going to come back and each of this we're going to go into detail. Please join us later on. Thank you so much for watching. Please subscribe to our channel because it put a lot of effort to put a video together. So in order to make more videos, we need your help. And please subscribe to our channel. Thank you so much.